We're having a rally to raise the cigarette tax. We're trying to get to $1.54 because that's the number we feel will help the most people quit smoking, young folks never start smoking, as well as fix budget problems with that money.
What is the current tax?
The current tax, we're the third lowest at 36 cents in the nation. You know, all the states around us are higher than that. Mississippi is at 68, Arkansas $1.15, and Texas even $1.41.
How would the state benefit from this increase?
Well, I think first off, folks will stop smoking. Young folks will never start. You'll see immediate health care benefits from that. The state pays I don't know how many millions in, Medicaid costs because of smoking. The money hopefully will go to health care the way the bill is set up now. That money will help us keep hospitals open, and, we can't afford to lose our private partnerships.
What kind of support does your bill have right now?
Well, we passed the bill out of the House with 78 votes. It's over on the Senate now in Senate committee, and I think they're looking at it favorably and even increasing the amount that the House had put on there. So I think we're in a good position.
What can the community do to come out and show their support so that they can ensure that this gets passed?
Well, the best thing to do is find out who your representative is, who your senator is, and contact them and let them know, yes, it's all right to raise a cigarette tax. It benefits everybody.
We are here to rally behind Representative Harold Ritchie's bill, which seeks to raise the cigarette tax to $1.18 a pack. You're going to learn a little bit about why it's so important that we get the tax up over $1, because it's at that point where we actually see health care benefits that will save lives, that will create a barrier to prevent young children from beginning to smoke. It's going to raise a lot of money for the state that will help protect our health care services for our elderly and infirm, and it's going to protect all of our institutes of higher education and community colleges. So it's just one of these rare win-win-win scenarios. Before I get started, I've got to thank you all for your commitment, and we've got folks here from all over the state. If you're from Shreveport, can you give us a shout out? Wow. Do we have any folks here from Monroe? Well, you all are committed. You ought to be committed coming out on a day like this, all this way. But that's what it's at. How about from Sinla? Anybody here from Central Louisiana?
Yeah, right here.
All right. The man in the kayak. Do we have any folks from Baton Rouge? Yeah. Anybody from New Orleans? New Orleans. We got. We actually have some folks here from a charter school making a visit and doing this. What school y'all from, darling?
Samuel J. Green.
Samuel J. Green. Shout out for Samuel J. Green. So. It's very interesting. I mean, in this day of all days, we've got our friends in Houston that are just getting walloped with storms. I know that our friends that came down from Shreveport have been fighting storms all day, and that's in fact why we moved from the steps of the Capitol. But what you're going to do today, everybody here is participating in a very important process, and that is educating legislators that this is more about trying to fill a budget hole. It's about trying to make a difference in people's lives. So we're going to hear from a few folks, but first of all, it's my great honor to represent a leader that I've admired for a long time. Representative Harold Ritchie represents Bogalusa, Louisiana. It's Washington Parish, which is just north of Lake Pontchartrain. And this gentleman has been fighting this battle for a long, long time. We have not had a cigarette tax increase in Louisiana for almost 13 years. We have the third lowest tax in the country, so almost no barrier at all for kids to begin smoking. Representative Ritchie's courage comes from deep within, and he'll tell you a little bit about why he is sponsoring this legislation and why he feels so fervently that it's important to the future of our state. And with that, Representative Harold Ritchie.
Thank y'all. It's It's a wonderful day for a rally on the steps of the Capitol, isn't it? I'm glad T and them were able to get this building for us and everything. And I want to tell you how much I appreciate y'all being down here. I get paid for being here today, you know, and all of y'all are volunteers coming down here to help with this. And it's real important. T mentioned about educating legislators about this bill and what a $1.54 increase would mean in saving lives, folks quitting smoking, young folks never starting. I can promise you a little redneck from Washington Parish who smokes pack-a-day cigarettes didn't come over here to raise cigarette taxes. But once I got here and listened to the debate and everything, I became convinced that that's what we should do, and I've worked hard for that. We have a tremendous opportunity this time. We're going to pass a tax, and with y'all's help, if you'll educate your legislators on what it means, I think we can get, you know, a number that will do us some good in improving our health care across this state. The tobacco companies, you wonder what they're doing is we're doing our increase. I pulled up an internet article the other day, and the title of it is Get Ready for Higher Cigarette Prices. Now you would think this might be something that T and them put out, but this is from the tobacco companies talking about they had just increased the price on a pack of cigarettes 7 cents a week or two ago. They had that increase back in November. They're planning another increase probably at the end of the year in November. And you know, that's 21 cents that the tobacco companies get to put in their pockets for their profits. We're talking about money that we can put in our budget to help health care and to help our citizens. And again, I just want to tell you thank you for being here, and let's keep working until we get this done. Thank you.
Okay. Thank you very much, Representative Ritchie. Next, we're going to hear from a gentleman, Edgar Hage, who represents Together Louisiana, is responsible for so many good efforts that go on in our state, and is always fighting a good fight. Edgar?
Thank you very much, and good afternoon. We have a problem. The problem is the harmful effects caused by smoking cigarettes to our lives, quality of life, and the monetary cost to our state and us as individuals. It is not a Republican or Democratic problem. It's not a black or white, rich or poor. It's not a North Louisiana versus South Louisiana. It's not smokers against non-smokers. The harmful effects caused by smoking does not discriminate. The harm affects us all. The harm to our residents' health should be compelling enough for a substantial raise of the cigarette tax. Annual health care expenditures directly related to smoking are $1.8 billion, billion with the B. The estimated cost of care related to secondhand smoke is $118.3 million. Combined, we're talking about nearly $2 billion of health care costs related to smoking cigarettes annually to our state. We have a problem. If the concern of the legislators is to reduce the health risks and costs, the additional 32 cents increase is insufficient. Why? The tobacco company has the resources to offset minimal tax increases by offering discounts and coupons. Consumption and use of cigarettes will not change. Consequently, the harm and healthcare costs will continue to rise. Few will benefit this low increase, while many will continue to be harmed. We all know that we've heard that we have a fiscal crisis in our state. Critical services and institutions in our state are facing budget cuts. Hospitals are facing serious financial issues because of possible reduced state support resulting from this crisis. Services will be affected include closing emergency rooms, which has happened already in Baton Rouge, and in some cases, possible closing of departments, and to the great extent, even the entire hospital. We have an opportunity to close this fiscal gap by increasing the tax closer to those of our neighboring states and the national average. This legislature was given marching orders that bills passed should be revenue neutral. The current amount received from tax on cigarettes is pale compared to the health care cost of nearly $2 billion. Let's start closing that gap by increasing the tax on cigarettes so the industry is paying for the harm that it's causing and not our state and our citizens. They should pay for the harm that they're causing, and it should be revenue neutral. Now, I know it's impossible trying to get up to the $2 billion in 1 year, but we can take incremental steps to get there, where they are responsible and paying for the harm that they cause. In closing, I would like to say that you've heard the effects of smoking has on our health care and costs. The monetary and psychological costs are priceless when premature deaths occur because of smoking. We have an opportunity to do something about it. I started by saying what this issue is not, pitting one side against the other. I will end by saying it is a choice between hospitals and tobacco. We should support those institutions that save lives and not the industry that end lives. Do this by raising the cigarette tax. Thank you.
Thank you, Edgar. Thank you. So this Investigate Healthy Louisiana is an unprecedented campaign, and it's made possible by a cooperative endeavor of some phenomenal organizations. The major partners are the American Heart Association, the American Lung Association, the American Cancer Society and their Cancer Action Network, and we also have the Campaign for Tobacco-Free Kids. The effort's been underwritten by the Rapides Foundation, which seeks to invest its resources in improving the health for people around the state. So we have some representatives here that are going to close out the program. We have Stasha Rhodes from the American Heart Association, Jennifer Kofer from the American Lung Association, and Kimberly Hughes from the American Cancer Society. Ladies.
Thank you, T. Brad. This is supposed to be a rally. Let's make some noise. My friend Aaliyah Miller will join me today to represent New Orleans and the students that we have. If we raise the tobacco tax to $1.18, we will ensure that 36,000 kids will never start smoking. So today is about Aaliyah and all of her friends here today. 30 states across the country have tobacco taxes higher than $1. 15 have tobacco taxes higher than $2. Louisiana has the third lowest tobacco tax in the nation at 36 cents. And it's been stuck there since 2002. But while cigarettes are cheap in Louisiana, the cost of smoking is high. We pay $1.9 billion in healthcare costs due to tobacco-related illnesses. 7,000 people a year die because of smoking-related deaths. The time for that to end is now. Today, we all stand together with all of our friends from all the organizations and all of you that have come from across the state to say that Louisiana deserves, we don't want it, we deserve a responsible cigarette tax now. A 32-cent tobacco tax increase is not enough. It's not enough to reduce smoking in Louisiana. It's not enough to save the lives that we lose, and it's not enough for Aaliyah. Today, we want more, we deserve more, and we thank you for your leadership, Representative Harold Ritchie. And today, when we walk across the Capitol, we're going to say it loud that we deserve more. Let me hear it.
We deserve more.
All right, thank you.
Good afternoon. My name is Kimberly Hughes, and I'm here today on behalf of the American Cancer Society Cancer Action Network, and we support a cigarette tax increase of at least $1.18. This year in Louisiana alone, over 24,000 people will be diagnosed with cancer, and over 9,000 of those will die. So while researchers are busy in the lab working on a cure for this deadly disease, our lawmakers need to be passing policy that can make an immediate impact on preventing this disease. This common sense, potentially life-saving piece of legislation is the right move for Louisiana. We all know that according to the U.S. Surgeon General, cigarette and cigarette smoke is bad. You think about lung cancer being caused by cigarette smoke, but cigarette smoke is now linked to over 17 types of cancer, including cancer of the pancreas, liver, stomach, and lung. It's time we finished what the Surgeon General started 50 years ago when he announced the link between the cigarettes and cancer. It's time for lawmakers to make a stand for the health of this state by supporting a tobacco tax increase.
My name is Jennifer Kofer with the American Lung Association in Louisiana. I want to thank our partners. Some were mentioned, some were not mentioned, but the Campaign for Tobacco-Free Living is a huge partner in this effort statewide, and you guys are here and brought people from Lafayette and Nacogdoches, I know, are all over the place. Did I say it right? That's Texas. That's Texas. Natchitoches. Put the right hat on. So, doing regional work kind of, gets to me. But what I've learned from being in Louisiana is that you guys are passionate people. And I've seen passionate people care for people. And we are asking you today to call upon your legislators that represent you. You're a constituent here. We are asking you to ask them for a $1.18 increase because that's what matters. A $1.18 is not just about a fiscal win. And when we use the word fiscal, that means money. It's a good thing for the budget for the state so they can fix problems. But ultimately, we're here because we want to fix problems with health care. We want to keep these kids from never starting, and we want to help your colleagues, your cousin, your wife, your spouse to quit, and to keep them, or trying to keep them from ever starting and helping them quit. So it's for the adults, it's for the kids. That's why we do this. A $1.18 increase, you'll see 34,000 kids never start, just with one vote of the legislature. 34,600 kids under 18 will never start. That's huge. We estimate with that same $1.18 increase, with one vote of the legislature, 43,400 adults would attempt to quit. 43,400 adults would attempt to quit. That's what we're asking. So the fiscal win is $223 million that we brought in the first year of a $1.18 tobacco tax increase. $223 million. That's the fiscal win, the money win, the public health win, thousands of lives saved, thousands of healthcare dollars saved. 5 years from now, you're going to see a major return on investment with the fiscal win, the public health win, and the people support win. Our politicians over there were elected by the people. The people support this. 70% of Louisianans were surveyed, and they support a $1.18 tax increase. So let's hear from the people. So it's not just about us. It's a call to action to the legislators at the Capitol. With one vote, they could save lives. They could save money, and they could fix the problems at the Capitol with this amazing solution for a $1.18 tax increase. And that's what we're calling on them today for. Thank you very much for being here today.
I'm here to support the calls for the taxes to be raised on cigarettes.
Why do you support that? How will this benefit the community?
Number one, I support the cause because I have had some personal incidents. I had a mother who died. She had bladder cancer, which was from cigarettes. I had a brother who passed several years ago. He died with esophagus. And then I had a sister 2 years ago that passed away. She too had lung cancer. All were smokers. And I'm here to support the cause to try to keep others from being in the same predicament that they were, and to give information, if possible, so that the younger children can follow and not get involved with cigarettes.
Do you think that the increased cigarette tax would have saved maybe your family members' lives?
It could have, because of research. It could have because of education. The more knowledgeable we are about what cigarette smoking can do, the better we are as a community.
Well, today we are educating our legislators about the importance of raising the tobacco tax to $1.54. Right now we have the third lowest tax rate on tobacco products in the whole country. So we need to improve our tax rate so that we can improve health. And we know, research has shown, and in other states where they've done this, that for every 10% of increase in the tax, there's about 4 to 7% of folks who actually either won't start smoking or using tobacco or will quit. So there's a lot of health benefits to raising the tax.
How exactly will those numbers correlate with Louisiana? How many people will be saved?
Well, we know that by raising our tobacco tax to the national average, we could prevent probably around 35 or 36,000 kids from ever starting to smoke. That right there is so important. They're the future, and we want a healthier future in Louisiana. So this increase could directly impact our kids.
And who is all affected by cigarettes? What about those that don't smoke? Why should they care?
Well, secondhand smoke also has a lot of toxins in it that for those of us who aren't smoking but we're in environments where there might be smoke, we're affected. And there are more than a dozen cancers that are linked to the toxins in tobacco products and tobacco smoke. So we want to be about prevention, and whenever we can create environments that are free of smoke and tobacco smoke and the toxins in it, we want to do that. So it's really important to advocate for tobacco-free and smoke-free environments.
Well, it would make a difference because in Louisiana, we know we have a crisis. We have a money crisis, but we also have a health crisis. And if we were to raise the cigarette tax to $1.18, it would raise revenue where we could have money to help the citizens of Louisiana become healthier because they would stop smoking, hopefully, or deter them from starting to smoke.
Do you have any personal stories of how cigarettes have affected your life?
But yes, I do. I had a sister that passed last year from lung cancer. And it was because she had smoked, but then she stopped. Her husband was a heavy smoker. And I'm concerned also because of secondary smoke. So that's my concern. And cancer is not just lung cancer, it's so many other cancers that it causes. And right now we need to start putting the citizens of Louisiana first. Stop thinking about people that can harm Louisianans, but think about people that can help them. Hospitals, they're the ones that help. And we can lose money, revenue, because the hospitals will be closing because of not enough money. Well, if we have a way of raising revenue for the state, which is through raising the cigarette tax, other states have done it and they've raised revenues, and I think this is a way to help us out of our monetary crisis by raising the cigarette tax to help the citizens of Louisiana.
Is there anything else you'd like to add?
I would like to also say that we want everyone to support Representative Rich's bill, HB 119, because the citizens of Louisiana, we deserve better.
How can people support that bill? How do they do that?
They can support it by contacting their representatives, asking them to support HB 119.
This has been an all-day affair. Tell me a little bit about what you've learned so far today.
So far, I've learned the benefits of this tax, that it will provide a lot of money that could go towards health care and also prevention of young people beginning bad habits such as smoking cigarettes or using tobacco products. And I think that it will also be beneficial as far as is our health care.
Do you have anybody in your life that has been touched by cigarettes?
Well, I believe that everyone has been touched by cigarettes, everyone, because I feel that we're all connected some kind of way, whether it be by blood or just, by country.
And if people want to get involved with this, what should they do?
I think that they should probably tell their congressmen and state representatives that they support this this cigarette responsible tax, and that it'll be beneficial.
And where can people get information about the topics we discussed, and also how can they get involved?
Gosh, there is such a great partnership of advocates, whether it's civic, business, associations, government agencies that are involved in tobacco control and advocacy work. So American Cancer Society is a great source. American Lung Association, the Campaign for Tobacco-Free Living in Louisiana is another great source. So a lot of information out there for anybody who wants to learn more and get involved.